This is the first episode of the diversity the dialogue by GNYPWD, and we have in Nigina with me, and she is working as the chief of innovation unit at UNFPA. And I would like to begin with uh, the the basic introduction of myself. My name is Puneet Singh. I work as a community manager at GNYPWD. That is the global network for young persons with disability. To give my visual description, I am a man. I'm a young man. I'm a young brown man from India, and I'm a person with dyslexia, dyspraxia, and is stammering as well. So this is like uh, 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 my basic visual description and introduction. And also I use pronouns he and him. uh, so in the beginning, Nagina, as I told you, she is working as the chief of innovation unit, and one of the most interesting thing I came to know about her, that she is the uh, uh, the founder of Equalizer Fund. So I would like to ask that what UNFPA and what especially you are trying to do through this fund, and what is this initiative?
Thank you, Puneet. And let me first say that I'm so happy to be with you and to be with you in that first podcast. And also, let me also follow your lead and introduce and describe myself. So, I am a almost 50 years old woman from Central Asia. I don't know if I call myself, yeah, I'm young in the I'm young in my spirit, but maybe not so young for someone like you from your perspective. So I have straight hair, black straight hair. I am from Central Asia, so looking like kind of mix between the European and the Asian person, mid age, and I'm a medical doctor by profession. So I lived and worked in the different countries of very low resource settings and contexts. So I really understand deeply the needs of the communities in variety of settings, from the low to middle to high income countries, and really happy to be here and discuss with you, yes, what we do at the United Nations Population Fund, as we call it now, United Nations Sexual Reproductive Health Agencies. So we are addressing the three key areas: ending unmet family planning needs, ending preventable maternal deaths, so no woman should die when she gives birth, and no women or girl should suffer from the gender-based violence or harmful practices. And part of it is the innovation, where I lead. And innovation has the fund, which I co-founded with organization, the Equalizer Fund. Equalizer Fund aims to disrupt inequality. How we do it? We do it through the two kind of pillars or arms of our work. One is investment. We do invest in with equity-free grants in the social entrepreneurs and social enterprises in the low and middle income countries, uh, and we give them seed funds, we give them mentorship, we give them coaching, we collaborate with others to help also to really bring to scale or mature the pilots and ideas they have in terms of innovation for women's and girls' well-being. And the second part of the Equalizer is a partnership, where we really bring different actors into the space. And we're launching this fall the new alliance, Equity 2030 Alliance. It's all about inclusive innovations, gender equity in innovations. With the key message is that the world is not designed for women, so let us redesign it. Let us include women and girls in the product design. Let us ask them, what is it they want? Is the product really designed and addressing their needs and wants? That, of course, also includes women and girls with the disabilities. Because oftentimes someone thinks they come with brilliant idea and that should work. But if you did not develop it with the people with disabilities without asking and engaging them, be sure that your product may not really respond to what they need, especially in the context where they are living and operating and working and educating. So, and part of it, the new challenge, which we just started to go together with the global network of the young persons with disability, we call it Accessibility Challenge, where we selected a few winners, 4 winners, from different countries to really bring up and scale and like develop further their ideas in terms of how they can disrupt inequalities, how they can make the world better and more accessible through their solutions to young people with disabilities, especially focusing on empowering the young women with disabilities, young girls with disabilities, and giving them a better space to live.
Yeah, thank you so much, Nigina, for that. Especially, I would like to share that my mom has been a survivor of the domestic violence. My father was abusive, and she never got access to the services that she needs. So she undergo a lot of abortions, as my father was pressurizing her. And I know how it feels, because she still like is living in pain. Like is all the damage that has been done cannot be, like, no medicine or no treatment can undo that, because the toll that her body has taken, it's enormous. And this project, like, I'm so fortunate that I have been associated with GNYPWD, especially on a project which is working around sexual and reproductive health of young women with disabilities, especially in the global south. Because we know in countries like India, we do not have the access, we do not have the basic facilities the at the ground level. So thank you so much. It means a lot, not only to meet to millions of people living in the global south, in the poverty, and that have no access to such basic needs. And that takes me to a very interesting thing that you have said, that uh, this world is not designed for women. So how innovation, like, can you give specific examples and strategies that UNFPA uses to bring on that innovation in the lives of women?
So here we, as I mentioned, we work on the two prongs basically. So one is how we can actually invest in the innovators, especially female innovators, because we know that just saying, "Oh, let's empower them," if they don't have access to resources and they have good ideas, without resources, it's really hard to do anything in this modern world. So you can have a lot of ideas, but to find someone who can give you that kick from the very beginning, who can help you to really be ready to fly before you can go to like big investors, so I don't know, others. So this is where we see, okay, we're not giving big amount of money. So compared to, I don't know, the venture capitalist investing firms, angel investors, we do not, we're not competing with them, we know that. But that modest amount we give, we still believe can help them to start, to really, take off. And then with also coupling it with the professional mentorship and coaching, we see how they thrive, how they're getting ready to be like bigger, grow, and then develop further their solutions. However, our criteria is the solutions should also serve the needs of women. So if we invest in those female entrepreneurs, we only select those who create something for women and girls too, in the area where we work, be it maternal health, family planning, gender-based violence. And for example, last year we ran our first innovation challenge, and we had 10 companies, entities, and there were really different solutions, starting from diagnostic tests, which simplify some healthcare, to the gender-based violence prevention and protection, to maternal health, telemedicine, mobile clinics, really different variety. And we see how through the process, we see how these companies grow, we see how they scale up, they reach out different regions, even some of them different countries already. So this is very empowering for us even to see how we work on that, because I don't know, it's an interesting statistics. For example, from the global patents, when the companies apply to get the patent on intellectual property, only 14%, which is 1/4, are coming from the women. That
Mm.
means I personally know that it's not reflecting how many women innovators are there. It's just that for some reason they're not enabled, empowered, or whatever barriers they face to apply. So it's really dominated by men. At the same time, we know when women innovate, it is by 30% more than we see more innovations coming also to address women's needs, because they know what are the problems are there. So I'm very sorry to hear about your mother's story. And at the same time, I know, like, if someone will be designing anything to address that issue in where you live or your mom lives, they should ask you what didn't work, why the protection system didn't work, why the community didn't step in, why healthcare system wasn't able to respond to that and help her in that situation. So unless we know those barriers from those who survived those situations, we will not be able to meaningfully address it, because something which works, I don't know, Europe, US, may not work in India, may not work in Kenya, may not work in Uganda, because everybody have their own cultural and financial and other aspects which needs to be really incorporated. And then another way, as I said, we're also building this partnership where it's not us redesigning the world, we make the companies redesign the world. So we partner with really big top technology companies, pharmacological companies, academia, to show what are they doing in their companies to make more women-centric solutions and more inclusive solutions. And this is where we also see it's important, because we as a UN, we do not produce really any products, but they do. And if they do, how can we use our power of convener to make them be more inclusive in their product design and make sure that what they create is actually addressing the needs of those for whom they created.
That is very interesting, because when you are not working directly and you're working as a convener, I think you must have facing a lot of challenges in communicating certain things. That uh, listening to the beneficiaries is really important. Like, if you're not listening and if you're not interacting with the beneficiaries, I think the product will be not of that much of quality and that much of use to the person. So I think what is the biggest challenge that comes while communicating to these companies and organizations?
Or a lot of challenges. I must say we're still at the beginning of the process. So first, to communicate what the problem is. When we talk about gender equity in the product design, the first reaction is, oh, but we do have so many programs about education in STEM, for example, that we educate girls, or we have more researchers women or more engineers women. But we say, okay, that's of course important too. But when those researchers and engineers do develop the product, be it a medicine, be it the diagnostic tool, be it the AI algorithm, I don't know, be it any technological other tool, do they actually ask that question? How many women are included in that process, in the data set? And it's not easy to find companies who do that. So the metrics do not exist. The question is not being asked. And overall, we also know that only 1% of global research and development budget, which is $2.6 billion, no, trillion. So from that, only 1% goes to women-centric solutions. This is so small that it's very easy to be ambitious and say, let's double, let's triple it. But women are half of the population. So you need to do better. It's like really obvious. We also always say, don't read women altogether as a niche of group with some special needs. They are not niche group. They are half of the actually majority of population. They live longer than men. So, and still they're being treated as some small group with, I don't know, some specified needs, which is not fair, of course, and not just, of course. So communicate that. That's one challenge, but we don't want to come with that with naming and shaming, so to say, strategy, because this is also we're talking to businesses. It's a business proposition. If you make your product more inclusive and design for more diverse group of people, and for also not just half of the population, but the all of the population, you also increase your markets, you also increase your sales, you increase people who buy your product, and we have examples when it was done, and the sales grow. So it's really a positive business proposition. This is what we're also trying to communicate, saying, look at it from, if it's a for-profit company, of course we do understand they're driven by profit, but it is about profit too. It's not only about human rights, it's not only about making sense of it, but it is also about profit.
Yeah, this is very interesting, Nigena, because I always think about that this world is not equitable. Always I think about, but when you said that it's like almost more than 50% of the population is being undermined, I think there is no equality equality as well. So I was wrong all this way, and this reminds me of your of this thing that you have in your work, like a disruptor of inequalities and inequities and innovation. That is really interesting. And I was thinking about, if you are writing inequity, why there is the requirement of inequality. But now I understand that why are you writing this, and it was not a jargon. Yeah, thank you for explaining that. And uh, and and also, like, it reminds me of when you said that it's not a niche group. I'm a person with disability, and I'm a very ardent advocate for equal rights for person with disability, especially in the global south. uh, so I think a lot of organizations are taking disability as a niche area as well. Although it's like almost 25% of the world's population. Like it's like organizations say it is 17 to 18%, but a lot of disclosure has been not done. So a lot of people are not saying that they have this kind of condition, because they fear that they may lose their job, or they may face some kind of discrimination in their offices, in their colleges and schools. So I think that's this accessibility innovation challenge is your first initiative with persons with disabilities. And how are you taking this, how UNFPA is addressing the cause of disability, and how their vision and mission is inclined towards the cause.
Thank you. And before I answer your question, since we have an audience here, I'd like to give maybe one illustrative example about equality and equity and where is the
Yeah.
difference.
Yes, yes.
Let's say you and me both invited to some panel discussion somewhere, I don't know, TV, everything.
Mhm.
And they give, okay, each of you have 3 minutes strictly to deliver
Mhm.
your message. And if I speak easily 150 words a minute, in those 3 minutes, I can say a lot. I can say almost 500 words. The same 3 minutes for you will probably mean different, especially, on the camera, on the stress, but also with the way you speak, the way you construct and think. So we are given equally 3 minutes each, but these 3 minutes didn't equitably consider what is it we actually need to deliver our message. And if you need 4 or 5 minutes to deliver the same message which I can deliver in 3 minutes, and you are given these 5 minutes, this is the equity. This is when you and me are treated equitably and not just equally. Okay, each of us got the spot and each of us got the same time.
Mhm.
So this is, and it's like having, stairs and the door for someone who is in a wheelchair. Yes, you have one entrance, you have the same street access. But if I'm in a wheelchair, I can't access it if there are only stairs. I need a runway there to get there. So there are different aspects of equity, which is not just equally distributing certain goods and benefits. That's why inclusivity is so important. That's why whatever we do, we need to think, okay, with whom we do it, for whom we do it, and that's why including those people as part of the discussion, design, decision making is so important. Which brings us to your question about how we UNFPA work with the persons with disabilities. And we have a two-pronged approach. So one is mainstreaming it through the programs. So whatever we do, everywhere we do, we now have our own corporate strategy. Everybody should be addressing. There is kind of a checklist what should be addressed. If any design program is designed, if any event is designed, if you design a website or app, or programming intervention, you need to be inclusive of persons with disability, you need to be thinking and engaging them in those processes. At the same time, we also do it through the programs and projects like interventions. And we have a We Decide program, which is focusing on the empowering women and girls with disabilities and enhancing their access to the sexual reproductive health and rights and protecting, preventing gender-based violence. And this is also what you mentioned, our first challenge on the innovation challenge, accessibility, where we announced call for applications. We partnered with two organizations because, again, from the very beginning, we said we can't be designing this change ourselves. We do not know what is needed. We do not know how to even design the challenge that it is accessible so we can reach those who are supposed to be applying to this challenge. So we partnered with the Global Network of Employers with Disabilities, which already were partnered with UNFPA, but not for the specific. So we brought them on board. We brought the Global Disability Innovation Hub on board. And together then we designed, okay, that will be the call for application. That's how we amplify the message. And honestly, for me, it was really big lesson learned also about how it's important to have people who understand the problem part of it. Because when we were selecting the winners, that was really interesting to see what we maybe would perceive for something interesting or, programmatic, impactful. But when you hear from people who actually would use it then, and they say, no, that would not work, and that would not work, and we don't need this, but we would need that. This is where the inclusivity and equity comes, because then you say, okay, yes, now we know that we selected the winners who actually work on something which potentially would be needed and impactful, and not just something which looks, I don't know, shiny somewhere on a web page.
Yeah, definitely. And also, like when I was reading about social change, and when I was starting to think about starting my own organization, working towards the disability cause, because I was discriminated in school, colleges, that then in my first job as well. So we were reading about SDGs, and with all these SDGs, I realized that uh, the goal number 17th is the most important one. Like if you ask me, I would say, collaboration and partnership is the key. And I really like appreciate like how UNFPA, GDI Hub, GNYPWD has been collaborating, and how we people have been like really working on to make this a success. So Nigina, as your like let's think about like little bit in future, like 6 months or 1 year, like what are the key uh, uh, success points would you like to see through this challenge, and how would you like to continue with this accessibility? Because for a person with disability, accessibility is innovation. Like if anything that is making our lives better, easy, then it's innovation. Be it tech or non-tech, it doesn't matter.
Agree with you. And but let me also use this spotlight time to introduce our winners, because we have
Yes.
four. And why four? Because we really agreed from the beginning that we are going not for quantity but for quality. So we received more than 200 applications from 54 countries. All regions were represented there, but not all of them were interesting enough or impactful enough in terms of what we see as a success. So one of our winners is AccessAble. They are from India, and they develop a solution to provide information about the sexual protective health topics using interactive engagement via SMS and interactive voice response. It doesn't require a computer or smartphone or any technical training. So another winner is the Technoprice Global. They are based in Kenya. They want to address the lack of effective data collection within the disability community. And they're really working close with the especially young women with disabilities to use the AI-powered platform that record and analyze what is it they need, what barriers they face. That helps them then to create evidence-based programming when they work with those like healthcare systems and others. So they say they bring the real concerns into that, and based on what actually they collected from them. Another one is the Aliante Infinite. They're based in Moldova. It's in Eastern Europe. So they're creating something as a podcast, as a mean to give young persons with disability a platform to express their voice, to talk about. And I know that maybe, for many, it may not sound like super innovative. They may say it's a podcast. But again, it's about this context. If in this community majority of people do not know about real lives and challenges of people with disability, how they live, what stigma is surrounding them, what marginalization may be surrounding them. That's the way to give them voice and a platform to empower themselves, to actually deliver to communities more understanding and more just treatment around themselves. And the fourth winner is the Vessels for Development. They are based in Cameroon, and they are developing a menstrual cycle tracking device, which helps young women in discreet way track their menstrual cycle, get more information, manage their fertility, sexual health in accessible way. So it's not like a usual watch or wearables. It's actually really designed to their needs, and they're reducing the barriers of them accessing this information. They are all receiving seed grants, but also receiving a very kind of hands-on, intensive, and tailored mentorship. So each of them, it's not like a generic workshop. Everybody come and listen. No, really, the partners develop really tailored approach to each of them. What is it they need? What they're missing, and how we can enhance their capacity to deliver. In terms of how success will look like, I am ambitious, but also not very ambitious here, maybe. But for me, if through these solutions, when they're ready, if a few more people with disabilities can have easier access, enhanced access, more accessible technology to really learn about get the information, empower themselves through the information as knowing about their rights and choices, be able to exercise their rights and choices, be better with their health and well-being. That's for me a success. I'm not aiming here for the skyrocket. I always say don't aim for the moonshot, aim for the roof shot. If we get a roof shot, that's also enough. It's a start. So if few people will say we benefited from it, if few people with disabilities will say our life got easier, better, we feel empowered, even the innovators themselves, and many of them are women, young women with disabilities, that's already a success. However, in terms of the next step, it's a very important question, because of course, if some of them, or hopefully all of the solutions are successful, then what's next? And the next usually comes with funding again, right? So we will should be thinking together how and who we can bring as a next investors. And we're also thinking about how we can model certain collaborations with the investors, where we bring from the pilot those winners and say, okay, we already worked with them. We know their solution is wonderful. We know it's impactful. We know community benefit. And we already helped them at the pilot stage. So now they're ready to present what they have to you investors. It may be not equity free. It may be loans. It can maybe zero revenue loans. It may be equity loan, investment. I don't know how it will look like, but I also think that's the way to grow, because if you're always depending on grants, that may not be a long-term sustainable strategy. Also, it's difficult to find grants non-stop. Usually grants are helpful at the beginning, but then you do need some kind of business model with the investors. And this is where we also hope to reach as a next step. Okay, those who are ready for scale, where can we bring them? Who can we bring to listen to them and maybe try to also invest in the scale up?
Yeah, absolutely, and I'm pretty sure that the exposure at the especially the mentorship that they will get, it will be super helpful for them, and especially like I find this one like the podcast project very interesting, because it's about the voice, and all these marginalized communities doesn't get that voice. So when we were I would like to share one thing, that when we were trying to start a podcast here at the GNYPWD. I just said, I don't know, I want to host that one, because as a person with stammering, like it's a symbolic thing that you are actually hosting something. It's the against that belief that we should not be talking, right? We should be just hiding, and that it is a big part of how I advocate for the equal like visibility of someone who stammers, who stutters in US. You guys said stutters, so that is very interesting. And the last question that, and again, I would like to let you go after that one, like uh, how, what makes you work at, this innovation like thing, what was your, I would say, turning point in your life, that you realize that I want to do something for the society as well, not just for like making money, but to do something for the world as well, to like give it back.
Well, first of all, I was never really making money. So, but the turning point was from being a medical doctor when you're 101 and you can improve life or not of, I don't know, dozen people, 30 people a day, sometimes save lives for some of them. And it's very rewarding because it's an immediate effect. And you, if you save someone's life or improve someone's health, you see it immediately. Like assisting in a childbirth, and you have that beautiful baby crying. It's very rewarding. But when you work in a very low resource settings and communities, you also realize that so much can be done if the systems improve, if there is more solutions to that, if what exists somewhere can be brought and adopted in that community settings. And this is where my work with UN started, that I thought, okay, if we try to work on a system level, on a more global level, it's not as immediate effect, of course, as when you treat a patient and you see immediate result. At the same time, the scale of the impact is potentially much bigger, and often it is much bigger. And here, in terms of innovation, again, stereotypes. Often people ask me, you medical doctor from Central Asia working on innovation? Because the stereotypes, it's a, I don't know, probably a white male from the west coast of US, in technology. And I'm disrupting the stereotypes here too. And I think, but it's so rewarding. I am genuinely passionate about each of our winner. So we now have 2 innovation challenges. We're starting another one, that third innovation challenge very soon. That I really, really wish, and I see that that's the way. That's the way to support. That's the way to source those innovation, and them working in the communities, knowing the best, the challenges of the communities. No one else will create a better solution than these entities, these companies, these teams. And if anyone starts to, I don't know, say something about the winners, oh, but this solution, why would it be, it's not really innovative, somebody else like did it. I say, well, but did somebody else did it there? No. Did somebody else actually help this community? No. So if for this community it is making change, it is making it better, easier, faster, more cost efficient, I don't know, less expensive, I mean, that's innovation. So don't tell me that just because it exists somewhere in Alaska and not in, I don't know, anywhere else. No. For this community, whether it's AI chatbot, whether it's a simple test, whether it's a podcast, whether it's a telemedicine or remote training, whether it's a mobile van bringing training to your doorstep or medical treatment to your doorstep, it is innovation. If it works for this community, if it wasn't done before, if it is adapted to the needs, to what you want, to what I want, to what people we serve want, it is innovation, and we should really, really support it. At the same time, we also know that there are many who are more privileged in getting access to resources, especially financing. We know that in the global south, it's much more difficult to get resources. We also know that even if you go more narrow in data disaggregation, for women, it is much, much more difficult to get. It's only, I think it's statistics, 7% of women only get access to financing compared to 93 of men. So can we disrupt that inequality too? Can we, with our modest maybe funds, but still change some numbers there, change some opportunities there, and empower not only those innovators, but the communities for whom they innovate? And that for me is so important, and it's really rewarding. So it's really giving me, I don't know, like it's a double boost of energy, because when you see those results, when you speak to people and you see how it's working, that's really, it's inspirational, it's really, really inspirational.
Certainly it is, and as you said, that the solution should come from the community itself, from the grassroots, because these are the people who are actually living in it, and especially if we are providing opportunities to the women, I think that is we are changing the whole discourse. And you are asking a very relevant questions. Like, thank you so much, Nigina, for being there. And it was very enlightening for me as well to understand all of these things that UNFPA is doing, and especially that you are also kind of disrupting and challenging the stereotypes by your presence only, and that is, I must say, that is very challenging. Thank you so much, Nigina.
Thank you, Puneet. It was pleasure talking to you, and thank you for your very interesting questions.
Bye bye, take care.
Bye.